Hello, and welcome to the GRACE podcast series. My name is Denise Brock, and I am the Operations Director for the Global Resource for Advancing Cancer Education, or GRACE. In this podcast series, we interview patients, advocates, and healthcare professionals to provide the most updated information for our community and to highlight important issues facing those dealing with a cancer diagnosis. We hope you find this information valuable. For questions or comments, please visit us at cancergrace.org.
Hello, my name is Tejas Patil, and I'm an assistant professor at the University of Colorado with the Thoracic Malignancies Program. I'm delighted to give a talk titled The Practical Principles of Biomarker Testing in Advanced Non-Small Cell Lung Cancer, and this is for GRACE. These are my disclosures, and these will be the objectives of today's talk. So we'll talk about the concept of oncogene addiction first. I think this is a really important concept in lung cancer. And what oncogene addiction really represents is that there are some cases where tumor cells rely on a single activated protein or a single pathway to maintain a malignant phenotype, that is, to remain active as a cancer cell. And this dominant pathway results in sensitivity of being targeted. When what I mean by that is, once we know what this dominant pathway is, in principle, we can develop targeted treatments that shut that pathway down. And because the cancer is so reliant on this pathway, it also means that the cancer can't effectively grow. And so here are some examples of pathways that have been shown to be important in cancer. And we can target these pathways in a couple of different ways. So one is through use of what's called a monoclonal antibody. This is a large molecule that typically targets cancer on the cell surface. The other is through something called TKIs, which stands for tyrosine kinase inhibitors. And these are typically small molecules that bind and block a pathway inside the cell or intracellularly. One way we can differentiate these two treatments is by looking at the last letters of any drug. Monoclonal antibodies typically end in words like mab. So you might see drugs like rituximab, cetuximab, amivantamab. That mab is cluing you in for the fact that it is a monoclonal antibody. Tyrosine kinase inhibitors typically end in ib. So drugs like osimertinib, alectinib, etc. In the past 15 years, the field of thoracic oncology has experienced rapid growth. And one of the key developments in this field has been an appreciation of the diversity of different oncogenes that we see in lung cancer. This is a really nice paper that was published in 2019 that demonstrates the pie chart of all the different oncogenes we see in lung cancer on the early stage, left, and on the metastatic stage, right. In total, approximately 45% of mutations in both the early and metastatic setting are targetable with currently available targeted therapies. And I need to update this slide as this is of 2021 and the field continues to expand and there's newer targeted therapies emerging in 2022. But the reason this is relevant is shown here. So this is data pulled from NCI, looking at cancer statistics from 2021. What you will notice is that lung cancer is the second most common cause of new diagnoses in men and the second most common cause of new diagnoses in women, but is overwhelmingly the leading cause of mortality for both men and women. And the reason molecular testing matters is, let's just do some math here. So if we look at the number of new cases diagnosed in 2021 alone, we get 235,760 cases of lung cancer. Now, not all of these cases will be non-small cell lung cancer. There's another entity called small cell lung cancer. So let's assume that 84% of these are non-small cell lung cancer. That leaves us with 198,038 cases. Now, if we take my estimate that 45% of these will have a driver oncogene, we're left with 88,424 cases of non-small cell lung cancer with a driver oncogene. And to put that in perspective, this is the number of cases of pancreatic cancers that was diagnosed in all of 2021. So driver oncogene non-small cell lung cancer is common and matters in terms of understanding the molecular for any patient who has a diagnosis of non-small cell lung cancer. So the reason that targeted therapy matters is shown in this slide. On the left-hand side is a really important study that showed that if patients have an EGFR mutation and you give them an appropriate EGFR drug, in this case, gefitinib, they do much better than if you give them chemotherapy. So their outcomes are better.
Thank you again for joining us. This podcast was made possible by the generosity of sponsorship from our friends at Lilly and Exelixis. Please like and follow us on Facebook and Twitter. Send us feedback, share your story, donate, and visit us for more information at cancergrace.org. Thank you for listening.